So I'm sitting down with Dr. Peter Glidden, and it's a pleasure. I've been wondering, this information on nutrition is so spread out, and I hit upon these 4 categories, and I thought this is an ingenious way to look at nutritional deficiencies, and I was hoping you could give me more of a background. Where did that come from? How did that come together?
Well, that is a very interesting thing to talk about. It generated because of 2 particular reasons. Right? The first reason was that we are attempting to put together health recovery protocols which are simple to do, simple to understand, easy to do, easy to understand for everybody, because healing is easy. Surgery is complicated. Healing is easy. You know, and everybody in this country suffers from the myth that, oh, if you have asthma, or if you have type 2 diabetes, or if you have congestive heart failure, that the only person that you must go to, the only person that can give you any type of a successful outcome is an MD working in a multi-million-dollar, high-tech, extremely expensive facility, and it's just nonsense, right? We don't know any better. The real thing here is that healing is easy. And so in breaking chronic health conditions down into 4 health categories, right, that was our attempt to put the information together in a way that made it very user-friendly, very accessible, and very easy for everybody. Because what we're up to here, let's make no bones about it, what we're up to here is changing the way that people think about their health, and changing the way that people access healthcare, and changing the way that people use medical information. And we're bringing information right into the homes of people. You know, this is self-care reform, right? Healthcare reform delivered in an easy to understand, effective, science-based, clinically verified method. So that was one reason, right? It was to kind of shorten the learning curve to help people recover their health, number one. Number 2, the FDA. Now, the FDA, I could talk for hours and hours and hours about the evolution of the Food and Drug Administration in the United States and their relationship between medical research and the pharmaceutical industry, and it is a gigantic problem. But according to the FDA, believe it or not, the only thing that can cure anything is a drug. So we could have 10,000 people who had type 2 diabetes, definitively diagnosed type 2 diabetes or asthma or arthritis or congestive heart failure or whatever, follow our clinical therapeutics, take our advice, and pursue our health recovery programs, and completely recover from their conditions, and we would not be able to say legally that we can cure anything. And also, because of the relationship between the pharmaceutical industry and vitamin companies, there is a gray area involved when you start to say that this particular nutritional supplement is a treatment for arthritis, or this particular nutritional supplement is a treatment for asthma. You can't say that because the FDA doesn't allow you to say that. There's all of these hoops that the FDA requires you to jump through in order to relate a nutritional supplement or a drug to a specific health concern. All right. So, and this is a bad thing for the American consumer, because I think when this law was originally passed, it was passed with good intentions, right?
Sure.
The intention was to keep people from putting stuff on the market falsely, saying, oh, we have the secret for asthma, and you really don't, right? So that was the intention of this law 100 years ago. But because of pharmaceutical corruption now, it's been completely turned on its head. And it's an out of control, the delivery of medicine in the United States is an out of control pharmaceutical juggernaut. And because of the way that the laws are, we're not gonna tickle the tail of that dragon. We're not gonna pull that tiger's tail. We're not gonna spit on Superman's cape, right? Or tug on Superman's cape. So what we do, instead of saying, well, this is what we recommend for the treatment of type 2 diabetes because that's against the law.
Sure.
What we say is, well, if you have type 2 diabetes, here's what we recommend to support and promote the health of your blood sugar.
Right.
If you have arthritis, here's what we recommend to support and promote the health of your joints. If you have a stomach ulcer, here's what we recommend to support and promote the health of your digestive tract, and so forth and so on. Now, this gets into a whole different zone of, kind of the clinical understanding even of the genesis of disease in the first place. So maybe we could talk about that in a different segment. But the reason that we have the 4 health categories is twofold. Number one, it's to avoid excessive, oppressive, pharmaceutical centrist, jackbooted thuggery by the FDA, number one. And number two, to put forth this information in a very easy to understand, user-friendly way, because really, healing is easy, man, and we're just trying to, shorten the learning curve here to help people recover their health quickly and